Hello, and welcome to Chapter 5, the Integumentary System. The skin is the largest organ of the integumentary system. It is also the largest organ of the human body. The skin and its appendages, sweat and oil glands, hairs, and nails make up a complex set of organs that serves several functions, mostly protective for our integumentary system, the first system that we're covering in Anatomy and Physiology 1. The skin covers the entire body. It has a surface area of 1.2 to 2.2 square meters and accounts for about 7% of the total body weight in the average human adult. Without our skin, we will quickly fall prey to harmful bacteria and perish from water and heat loss. The skin is composed of two distinct layers. The epidermis and the dermis. The epidermis is the most superficial layer or the most external layer of the skin. It is composed of epithelial cells. It is the outermost protective shield of the body. The underlying dermis makes up the bulk of the skin. It is composed mostly of connective tissue. Only the dermis is highly vascularized. You learned in your tissues chapter that the epithelium tissue is avascularized, meaning it doesn't have blood supply. The epidermis is made up of epithelial tissue, and you can clearly see from this diagram that no blood vessels are progressing through the epidermis layer. However, in contrast, the dermis layer has blood vessels that you can see here, the arteries and the veins, characterizing this layer of connective tissue as being highly vascularized. The subcutaneous tissue lies just deep to the skin. It is not a layer of the skin. It is also known as the hypodermis, hypo meaning below the dermis, or the superficial fascia, because it is superficial to the connective tissue wrapping of the skeletal muscles. As I mentioned, the subcutaneous tissue is not a layer of the skin, and it consists mostly of adipose tissue. The subcutaneous tissue also acts as a shock absorber and an insulator that reduces heat loss. We are going to identify all of the structures in this diagram of the skin. It represents actual skin, its two layers, the layer that's found underneath the skin, and then all of the accessory structures that are found within our skin. The epidermis, the most superficial layer of the skin, consists of 4 distinct cell types and 4 or 5 distinct layers, depending on its location within the human body. The cells populating the epidermis include the keratinocytes, the melanocytes, the dendritic cells, and the tactile epithelial cells. Let's talk about each cell. The keratinocytes are the chief role for producing keratin. Keratin is a fibrous protein that helps give the epidermis layer its protective properties. Keratin is a protein that dries out the cells found in the epidermis layer of the skin. Most epidermal cells are keratinocytes. They arise from the stratum basale layer, and by the time the keratinocytes approach the skin surface, they are dead, scale-like flat sacs completely filled with the protein keratin. Millions of dead keratinocytes rub off every day, giving us a totally new epidermis about every 25 to 45 days. The keratinocytes. The second type of cell found in our epidermis layer will be the melanocytes. These are cells that synthesize the pigment melanin. Melanin protects the nucleus of our cells from the damaging effects of ultraviolet radiation in sunlight. The third type of cells will be our dendritic cells. The dendritic cells are going to be our immune cells of the integumentary system. They are also called Langerhans cells. They ingest foreign substances and are key activators of our immune system. And the last type of cells that we can find in the epidermis will be tactile or Merkel cells. Our tactile cells have sensory nerve endings, and their function is sensory receptor for touch. They give us the perception of touch. This diagram represents the layers of the epidermis. Variation in epidermal thickness is what determines if the skin is considered thick skin or thin skin. Thick skin, which covers areas subject to abrasion, which will include the palms of the hand, the fingertips, and the soles of the feet. The epidermis consists of 5 layers, or we can call those layers strata or stratum. From the most superficial layer to the deepest layer, these layers include the stratum corneum, the stratum lucidum, the stratum granulosum, the stratum spinosum, and the stratum basale, which is the deepest layer. This diagram represents thin layer thin skin. As you can see, it only has 4 strata. The layer that's missing is the second from the most superficial layer, which is the stratum lucidum. Lucidum is absent in thin skin. In thin skin, which covers the rest of the body, the stratum lucidum appears to be absent and the other stratum are thinner. Let's talk about each layer and their characteristics. The superficial layer, the stratum corneum, is the outermost epidermal layer. It has about 20 to 30 cell layers, and it accounts for up to 3/4 of the epidermal thickness. It has anucleate cells, meaning that it has cells that are absent of a nucleus, meaning that they cannot regenerate or go through cell division or mitosis. The cells of the stratum corneum are shed regularly. These cells are the dandruff that shed from the scalp and the flakes that come off dry skin. In a lifetime, the average person sheds 18 kilograms or about 40 pounds of these dead, flaky cells. The stratum lucidum, which is not seen here but is found in thick skin, is going to be made up of dead keratinocytes. The next layer, moving deeper into the skin, would be the stratum granulosum. It's a very thin layer of cells. It consists of 5 cell layers. This is where keratinization, the process of keratinization begins, where we're going to produce keratin. The next layer is the stratum spinosum. It is several cell layers thick. And now we arrive at the bottom or deepest layer of the epidermis, which is the stratum basale for stratum basomembrane. It is attached to the underlying dermis of the skin, which is the deepest layer of the skin. It is going to be highly vascularized. It receives the most of the nutrients for the skin because it's connected to the dermis layer, which is connective tissue, which is highly vascularized. Okay, looking back at our picture, that was the epidermis and its characteristics. Now let's discuss the dermis. The dermis is made up of strong, flexible connective tissue. It has two layers, the papillary layer and the reticular layer, which lies next to the indistinct boundary of the hypodermis. The papillary layer is the thin superficial layer of the dermis. It is made up of connective tissue. It has collagen and elastic fibers, as well as small blood vessels. It has projections from its surface called the dermopupilla. They are indented and overline our epidermis. The papillary layer also houses our free nerve endings, which will be our pain receptors. And it also houses our tactile corpuscles or Meissner's corpuscles for touch. The papilla are also going to lie atop large dermal ridges, and these dermal ridges are in turn going to form epidermal ridges, and collectively these skin regions that are referred to as friction ridges may enhance our ability to grasp certain kinds of surfaces. The friction ridge patterns are genetically determined and unique to each one of us. And they are what's going to form our fingerprints. The deepest layer of the dermis is the reticular layer. It accounts for about 80% of the thickness of the dermis. It is made up of connective tissue. That connective tissue has collagen fibers. The collagen fibers give the skin its strength and resiliency that prevents minor jabs and scrapes from penetrating the dermis. The collagen fibers can run in various planes. And these planes are going to be on the surface of the skin. Separations or less dense regions between the bundles will form cleavage lines. These are externally invisible lines. They are important to surgeons because when an incision is made parallel to these lines, the skin gapes less and heals more rapidly. In contrast to if the surgical incision runs perpendicular to these lines, then it's going to leave a very big scar in most cases, but it's also going to be painful and take longer to heal. The dermis layer, specifically the reticular dermis, is also going to have flexure lines. They are dermal folds that occur at or near the joints where the dermis is tightly secured to deeper surfaces. It forms a crease over our palms. And extreme stretching of the skin, such as during pregnancy, can tear the dermis, leaving silvery white scars called striae, better known as stretch marks. There are several pigments that can determine our skin color. They are melanin, keratin, and hemoglobin. Melanin is a polymer made of an amino acid called tyrosine. Its two forms range in color from reddish yellow to brownish black. Melanin is synthesized by an enzyme in our melanocytes. All humans have the same relative number of melanocytes. Differences in skin color reflect the kind and amount of melanin pigment that is produced and retained. Freckles and pigmented moles are known as nevus, are local accumulations of the pigment melanin. Prolonged sun exposure causes a substantial amount of melanin accumulation, which helps protect the DNA of skin cells from UV radiation by absorbing the rays and dissipating the energy as heat. However, despite melanin's protective effects, excess sun exposure eventually can damage the skin. It causes the elastic fibers to clump, which can result in thick, leathery skin. It can temporarily depress the immune system, and it also can alter the DNA of the skin cells, leading to skin cancer. The second pigment, keratin, is a yellow to orange pigment found in certain plant products such as carrots. Carrots were mentioned, so this pigment must be yellow or orange. Keratin can be converted to vitamin A. Vitamin A is one of our water-soluble vitamins. It is essential for normal vision as well as for epidermal health. And the last pigment will be hemoglobin. Hemoglobin gives a pinkish hue of fair skin. It represents oxygen being bound to our red blood cells circulating through our dermal capillaries. Healthcare providers can quickly determine important information about a person's health from the color of their skin. Alterations in skin color provide clues about certain diseases or emotional states. Cyanosis, which is a blueness color to our skin, suggests that hemoglobin is poorly oxygenated, meaning that it's unsaturated with oxygen molecules. This cyanosis or blue color can be especially noticeable in our mucous membranes and on our nail beds. It is a sign of respiratory or cardiovascular problems. Pallor or blanching, a pale color to the skin. It's most noticeable during emotional stress. It represents low blood pressure or anemia, where we have decreased ability of our blood to carry oxygen molecules. Redness or erythema is where we have redness of the skin, usually seen during embarrassment, where you're blushing, fever, inflammation, or allergic reactions. Yellowness is going to be as a result of a yellow pigment that accumulates in our body tissues when the liver doesn't function properly. This pigment is bilirubin, a waste product from red blood cell breakdown. The result that is observed will be considered or known as jaundice, where the sclera of the eye and also in severe cases the skin is going to be yellow. Eating large amounts of yellow vegetables, which contain keratin, can also cause jaundice or yellow skin. Red, purple, green, or yellow marks that we can classify as bruises or ecchymosis on the skin or hematomas occur when blood vessels are damaged and leak to the surrounding tissue. And brown or black necklace or bruises around the neck. Dark areas in the axilla and around the neck are sometimes seen or known as hyperpigmentation, can be a sign of insulin resistance and elevated blood glucose in diabetic patients. Along with the skin itself, the integumentary system includes a number of associated structures. These skin appendages include hair and hair follicles, nails, sweat glands, and sebaceous oil glands. Each will play a unique role in maintaining the body homeostasis. They all will derive from the epidermis. And let's discuss hair. Its main function in humans is to sense insects on the skin before they bite or sting us. Hair on the scalp can protect us against physical trauma, heat loss, and sunlight. Our eyelashes will shield our eyes. Our hair found in the nose can filter large particles like lint, insects, pollen, or any debris found in the air that we inhale. Hair is known as pili, and it consists largely of dead keratinized cells. Nails are found on the distal part of our fingers and toes on the dorsal surface. Changes in nail appearance can help diagnose certain health conditions. And our sweat glands, also called sudoriferous glands, are distributed over our entire skin surface, except for the nipples and parts of our external genitalia. We have two types of sweat glands, eccrine and apocrine. Our sebaceous oil glands are found all over the body except in the thick skin of the palms and soles of the feet. These glands secrete an oily substance called sebum. Sebum softens and lubricates the hair and the skin. So typically our sebaceous oil glands are found adjacent and attached to our hair follicles. They lubricate the hair and the skin. They prevent hair from becoming brittle, and they also slow water loss from the skin. They have bactericidal properties. They increase their activity during puberty under the influence of sex hormones. Okay, and let's go back to our sweat glands. We have two types of sweat glands, eccrine and apocrine. Our eccrine sweat glands, also called merocrine sweat glands, are far more numerous or abundant than our apocrine sweat glands, and they are most abundant on the palms of the hand, the soles of the feet, and our forehead. Their functions are temperature control, and they have some antibacterial properties. They secrete commonly sweat. Sweat is acidic with a pH between 4 and 6. Sweating's major role is to prevent the body from overheating. The apocrine sweat glands, we have approximately 2,000, largely confined to our axillary and anogenital areas. They are also known as merocrine glands. They begin functioning at puberty under influence of sexual hormones. We have two important types of modified apocrine sweat gland. Sweat glands. They are your ceruminous glands. They are modified apocrine glands found in the lining of the external ear canal, and they are going to secrete a substance called cerumen, or what we know as earwax. Earwax is thought to deter insects and block entry of foreign material into our ear canal. The second type of modified apocrine gland would be our mammary glands. They secrete milk, and they are a part of the female reproductive system. Okay. The functions of the skin include protection. First and foremost, it is a barrier. It has body temperature regulation functions, cutaneous sensation, and metabolic functions. It serves as a blood reservoir and also excretion. Let's talk about each one. Given its superficial location of the external body, the skin is our most vulnerable organ. It can be exposed to microorganisms, receive trauma from abrasions. It withstands temperature extremes, harmful chemicals, and UV radiation. It has three types of barriers: chemical, physical, and biological. The skin's chemical barriers include secretions and melanin. Skin cells also secrete natural antibiotics called defenses, and the pigment melanin provides a chemical to shield, preventing UV damage to our skin cells. The physical barriers are based on the continuity of the skin and the hardness of its keratinized cells. The outstanding barrier capacity of the skin arises from the structure of its stratum corneum, the most superficial layer of the epidermis of the skin. The epidermal continuity wards off bacterial invasion. The glycolipids of the epidermis block most diffusion of water and water-soluble substances between our cells, preventing both their loss from and entry into the body through the skin. However, there is a continual small loss of water through the epidermis. Substances that can penetrate the skin in limited amounts include our lipid-soluble substances such as oxygen, carbon dioxide, and our fat-soluble vitamins. Our oleoresins such as poison ivy and poison oak. Organic solvents such as acetone, paint thinner. Salts of heavy metals such as lead and mercury that we find in the paint in our homes. Selected drugs such as nitroglycerin that's used to treat chest pains, or our seasickness medications, scolopamine. Drug agents that can help penetrate other drugs into the body are also able to penetrate the skin in limited amounts. Our biological barriers include the dendritic cells of the epidermis and the macrophages found in the dermis. Our dendritic cells are also known as our Langerhans cells, and they are our immune cells of the integumentary system. Body temperature regulation. The body works best when its temperature remains within homeostatic limits. Our normal body temperature is 98.6 degrees Fahrenheit. We need to get rid of the heat generated by our internal reactions. As long as the external temperature is lower than our body temperature, the skin surface loses heat to air and to cooler objects found in the environment. Under normal resting conditions, our sweat glands secrete about 500 milliliters of sweat per day. This routine and unnoticeable sweating is called insensible perspiration. When our body temperature rises, the nervous system stimulates our blood vessels to dilate and sweat glands into vigorous secretory activity. On a very hot day, sweat becomes noticeable and can account for the loss of up to 12 liters of body water in one day. This visible output of sweat is known as sensible perspiration. The process of evaporation of sweat from the skin surface dissipates our body heat and efficiently cools the body, preventing overheating. When the external environment is cold, our dermal blood vessels constrict, and this constriction causes warm blood to bypass our skin temporarily and allows the skin temperature to drop to that of the external environment. This will slow passive heat loss from the body, allowing us to conserve our body heat. The next function is cutaneous sensation. This is where we can perceive stimuli arising outside the body. Our cutaneous sensory receptors, known as exteroceptors, will include our tactile or myelin corpuscles, where they allow us to perceive the caress or the feel of our clothing against our skin. Our lamellar corpuscles alert us to bumps or contacts involving deep pressure. Our hair follicle receptors, along with the erector pili muscle, will allow us to feel wind blowing through our hair and a playful tug on our ponytail. It will also, the erector pili muscle, when it contracts, it will also allow the hair to stand up on, say for instance, our arms, but on the external surface of our skin, giving us goosebumps. And free nerve endings that will allow us to sense painful stimuli, irritating chemicals, or extreme heat or cold temperatures. Our metabolic functions include the production of vitamin D. When sunlight interacts with our skin, cholesterol molecules are converted to a vitamin D precursor, which is ultimately converted to active vitamin D, which can play a role in calcium metabolism. Calcium cannot be absorbed from our digestive tract from the foods that we ingest without vitamin D that's produced by our skin with the help of the sunlight. Collagen is also produced and it serves to deter wrinkles in our skin. It is going to be at the hands of an enzyme that's produced by our skin cells called collagenase. And it is going to allow the natural turnover rate of collagen. Blood reservoir. Our dermal vascular supply is extensive and can hold about 5% of the body's entire blood volume. We already talked about how these blood vessels are going to constrict and allowing us to regulate our body temperature. And the last function, excretion. The body eliminates limited amounts of nitrogen-containing waste in our sweat, which will include ammonia, urea, and uric acid. Profuse sweating is an important avenue for water and salt or sodium chloride loss. So we will talk about that at a later date in anatomy and physiology too. And let's talk about skin cancer and burns. They are major challenges to the body. We're going to summarize and characterize our three major types of skin cancers. And we are going to look at and discover why burns are life-threatening. The most important risk factor for skin cancer is exposure to UV radiation and sunlight and tanning beds, which can damage our DNA nitrogenous bases. The three major forms of skin cancer are basal cell carcinoma, squamous cell carcinoma, and melanoma. Here we are looking at a photograph of basal cell carcinoma. It is the least malignant skin cancer, but it is the most common. The cancer lesions occur most often on sun-exposed areas of the face and appear as shiny dome-shaped nodules that later develop into central ulcers with a pearly beaded edge. They can be treated by surgical excision. Squamous cell carcinoma is the second most common skin cancer. It arises from the keratinocytes of the stratum spinosum layer in our epidermis. They arise most often on the head, including the scalp, the ears, and the lower lip, and also the hands. They grow rapidly and they can metastasize, moving to another location within the human body if not removed. Treatment is usually surgical and also radiation therapy. And the third type of skin cancer is melanoma. This is cancer of our melanocytes. It is the most dangerous skin cancer, obvious by how it looks in comparison to the other two photographs. It is highly metastatic and it is resistant to therapy. The American Cancer Society suggests that we regularly examine our skin for new moles or pigmented areas. We can apply the A, B, C, D, E rule. A stands for asymmetry. This is where the two sides, this is where the two sides of the pigmented spot mole do not match, so it's asymmetrical. B stands for border. The borders of the lesion exhibit indentations or irregularly. C stands for color. The pigment spot contains several colors, blacks, blues, browns, and sometimes red can be seen. And D stands for diameter. The spot is larger than 6 millimeters in diameter, or that's the size of your pencil eraser. And E is for elevation. And also evolution. Elevation meaning that it's raised from the skin, and evolution is it changing within a short period of time. So the ABCDE rule is used by the American Cancer Society, suggesting to us that this is how we should monitor any abnormalities on our skin. And let's talk about burns. A burn is tissue damage inflicted by intense heat, electricity, radiation, or certain chemicals, all of which can kill our cells in our skin. The immediate threat to life resulting from severe burns is a catastrophic loss of body fluids, which can lead to dehydration, and also loss of body fluids can lead to electrolytes being lost from the body, therefore electrolyte imbalance, and ultimately renal failure and circulatory shock. The loss of fluids must be replaced immediately by intravenous fluids. Infection is also going to pursue, which means that antibiotics and also putting these individuals in isolation. Burns can be classified according to their severity or depth as first-degree burns, second-degree burns, and third-degree burns. First-degree burns and second-degree burns are known as part-thickness burns, and third-degree burns are known as full-thickness burns. First-degree burns that we see here on the fingertips are only where the epidermis layer of the skin is damaged. Characteristics include localized redness, swelling, and pain. Sunburn is a typical example of a first-degree burn. Second-degree burns injure the epidermis as well as the upper region, so specifically the papillary layer of the dermis. It is going to have all classic observations or symptoms of first-degree burn, but it is also going to include blisters. The area is red and painful. Skin regeneration occurs with little or no scarring within 3 to 4 weeks. And our third-degree burns or full-thickness burn is where the entire thickness of the skin is damaged. That includes the epidermis, the dermis, and also that layer found underneath the skin, the hypodermis. Since the nerve endings have been destroyed, this burned area is not painful, which are classic classifications of first degree and second degree burn. The skin might eventually regenerate, but depending on its severity, it is usually impossible to wait the long for the skin to regenerate because of fluid loss and infection that can pursue. So typically treatment for third degree burns is going to be skin grafting. In adults, the percentage of of body surface burned is estimated using the rule of nines. This method divides the body into 11 areas, each accounting for 9% of the total body area, plus an additional area surrounding the genitalia area, accounting for about 1% of the body surface area. The epidermis develops from the embryonic ectoderm, that primary germ layer, and the dermis and subcutaneous tissue develop from the mesoderm. By the end of the 4th month of development, the skin is fairly well formed. The study of the skin is called dermatology. Aging skin, as old age approaches, the rate of epidermal cell replacement slows. The skin can thin, and its susceptibility to bruises and other injuries can increase in aging skin. Our elastic fibers clump and collagen fibers become fewer and stiffer. The fat layer, or the hypodermis layer, diminishes, leading to intolerance to cold, which is common in older individuals. Declining levels of sex hormones result in similar fat distribution in elderly men and women. The decreasing elasticity of the skin, along with the loss of subcutaneous tissue, inevitably can lead to wrinkling. And this completes our integumentary system. Thank you.